Hi, welcome to the next edition of the Pet Factor. I'm Dr. Jim Hosek.
And I'm Brittney.
And this week we're going to start talking about congestive heart failure in dogs and cats.
Yeah.
We primarily see it in the older small breed dogs with the heart murmurs.
Okay.
So they'll come in and usually they have a leaky mitral valve, which is on the left side of the heart, or the tricuspid valve, which is on the right side of the heart. And that can cause fluid buildup because of blood not getting to the lungs.
Okay.
So it tends to build up into the rest of the body, and we'll see ascites and fluid buildup. When the left side of the heart is not pumping well, if it's leaking back, then it starts to back into the lungs, and that's when we get the coughing and the crackles in the lungs. Another reason we'll see we'll see congestive heart failure in dogs is dilated cardiomyopathy.
Okay.
And this has been in the news a lot because of the grain-free diets being associated with it.
Mm-hmm.
It's primarily, though, a genetic disease that we see in the larger breeds of dogs. Boxers, Dobermans, Rottweilers are prone to this. We'll see it in Great Danes. Cocker Spaniels are another breed that get it quite often. And it's just basically the heart muscle is getting very weak, and it gets very thin, and the heart starts getting really big. You take an x-ray, it looks like there's a big balloon in there instead of the regular heart. And so the heart can't pump efficiently, so it causes the blood to back up into the body. In cats, they have almost the opposite condition. It's a hypertrophic cardiomyopathy, and that's genetic as well. And that's where the heart muscle gets really thick, primarily in the ventricles.
Okay.
So the heart muscle gets so thick, the ventricles can't fill properly with blood. And so it's not pumping enough blood, and it starts backing up in the body as well. So no matter what the cause, the symptoms are going to be pretty much the same, and it really depends on what side of the heart is affected more than the other. We classify heart disease in 4 different stages. Stage A is for patients that are at risk but have no overt signs of heart disease. So this might be a boxer that has a history of dilated cardiomyopathy in his family. Mm-hmm. So we know it's at high risk. We're going to be watching this dog. We're going to classify it as a Class A. Class B heart failure is animals that have a structural heart defect or heart disease, but no signs of heart failure. Okay. So that's going to be the little toy poodle that comes in with a grade 3 heart murmur, but it's running around fine. We take an x-ray, the heart's not big, everything's looking pretty good, the lungs sound fine. Grade C, or Class C, is going to be animals that do have clinical signs of heart failure or who have had clinical signs of heart failure and responding well to treatment.
Okay.
So the animal that comes in that's coughing, it's got a little fluid in its lungs. We put it on the diuretics, the heart medications. They come back a couple weeks later. They're breathing fine. They're doing well. The D patients, the Class D, are the ones what's called refractory heart disease. So these are the ones that no matter what we do, we just can't seem to get them out of heart failure. So they're having a tough time breathing. They're the ones that are turning blue. Even with oxygen, they just can't get enough blood going through their systems. So the primary symptom we see coming in, if we're not finding on our exams, is they're coming because the dog's coughing. Mm-hmm. They're coughing, especially when they wake up in the morning is the worst, but they may have trouble getting to sleep at night with that. They have exercise intolerance, so they can't really get around very easily, so they get into respiratory distress. They may even start turning blue, where they start to do a little bit of activity and they start panting, and their gums are blue, their tongue's blue. In the cases of the right-sided heart failure, they'll get ascites, which is the fluid buildup in their abdomen. And it looks like they swallowed a ball as their belly's really big. Mm-hmm. We see this sometimes in the cats, too. And then fainting, which is syncope, or just because they're just not getting enough blood to their body. Like I said, they get tired. And weight loss is another very common symptom in heart failure. I had one cardiologist tell me that he's never seen a fat dog in heart failure. Usually they're pretty skinny by the time they get to that point. So we're watching for those. It's important when we examine these dogs that we're doing a good cardiac exam with the stethoscope. We want to listen for that heart murmur and ideally try and localize where it is. Because where it is can sometimes tell us what valve is affected without having to do an ultrasound. Okay. In cats, a lot of times they hear the murmur along the center of the chest, along the sternum. And dogs with the mitral valves will usually hear it on the left side, and that's usually by the heart base. But we can hear heart murmurs everywhere, and congenital patients will hear different types of murmurs, but that's a different talk. So we'll talk about that at some other time. We're going to also be listening to the lungs. So we can sometimes hear like crackly sounds, like people crickling up tissue paper when we listen to the lungs. If there's fluid buildup around the lungs, we'll hear decreased lung sounds because the lungs aren't expanding all the way in the chest. And that's called pleural effusion, and that's the same sort of thing that's happening when you get the fluid in the belly. You get the fluid around the lungs instead of inside the lungs. So there's a difference between those things. And then we're also going to be listening to the rhythm of the heart. When we have animals with the dilated cardiomyopathy, they'll oftentimes have a very fast heart rate and a very irregular heart rate because they might be in a condition called atrial fibrillation. In cats, especially, we can hear split heart sounds. So instead of the normal lub-dub, we hear a lub-dub-dub, lub-dub-dub, or something like that, which tells us that the heart, two parts of the heart are not in synchrony, and one's probably a little bit bigger, and it's having a longer time to finish its contractile phase and that valve closing. So those are very important things that we can do on our exam in the room. We're going to also look at the color of their gums and their body condition, and the history is very important too. When is the cough worse? How long has it been going? How long is it progressing? Does it tend to go away? Does it get worse with exercise? We want to distinguish heart disease from the other things that can produce very similar symptoms. So primary lung disease will oftentimes present with a cough and tiredness. And you can have a heart murmur and have lung disease that's not related to the heart murmur. So you treat them for heart disease and you're not getting better. It's because, well, that's not what's causing the problem. There's something else going on. We're also going to look for cancer. That can certainly cause fluid buildup in the abdomen, around the chest. It can cause lesions in the lungs that can look like pulmonary edema in severe cases. And infections, pneumonia. We had a dog in the other day that was treated for pneumonia, and they found that it had a dilated cardiomyopathy too. So they could be concurrent or just additional things on top of everything.
Sometimes we hear for the smaller dogs, those collapsing tracheas, and we confuse it for heart issues sometimes when they're just coughing.
It's the same types of dogs are getting heart disease or getting that little collapsing trachea. So we're going to make our diagnosis not only based on our exam, but we're going to get some chest x-rays too, and that's just the gold standard. We try and do 4 views, so we do them laying on the right side and left side, on their back and on their stomach. And that allows us not only to evaluate the heart very well, but the lungs as well, and see if certain lung fields are being involved more than others that would kind of rule in maybe some other pulmonary diseases. We're also going to get some measurements of the heart. There's a measurement that's called the vertebral heart score, which was developed that allows us to measure the heart relative to the vertebrae along the chest, and we can get a ratio of we take the long axis of the heart and the short axis of the heart, make a little cross right through the heart, and we transfer those measurements up onto the vertebrae and see how many vertebral bodies those measurements are. And so if they're within the normal range, we know that heart's normal. And you can have some dogs that heart looks really big on the x-ray, but because of the size of their chest or their breed, is really a normal size heart. So that vertebral heart score helps eliminate all those variabilities on the dog's breed and size and chest size, and gives you a really good way of seeing if that heart is indeed enlarged. In some hearts it's just really obvious because you can see an elevation of the trachea that's going to appear higher, or you're just going to see not very much lung fields at all. Where you start losing that sort of heart shape, they get more round and globular. The other thing that's going to be helpful are the EKGs or the ECGs. That's measuring the electrical activity in the heart. So we're looking not only at the rhythm, but depending on the strength of the electrical activity, we can tell if the heart's enlarged, if there's more heart muscle working harder. So when we see what's called the QRS waves, which are the big tall waves getting much bigger than 2 or 3 millivolts, then we know that's some pretty significant enlargement. Same thing with the atrial waves, the P waves. If they're getting a little bit bigger, we'll be able to say that looks like heart enlargement. Or if they're getting wider, that can say it's taking longer for the electrical activity to get through the muscle, so it's a much larger chamber than normal. So that can be very helpful for us. It's very good in diagnosing the atrial fibrillation. We can sometimes see the tachycardia, which is increased heart rate with the EKG. We'll see abnormal beats sometimes that may not even be related to the heart failure, but that might be there. But they can tell us that there's something going on in the heart. And there are other things that can cause abnormal rhythms that aren't related to the structural heart diseases. There can be electrical defects that in the pathways going through the heart too, but that's, again, a different subject, and we'll talk about that maybe in the future. The gold standard, of course, is the echocardiogram. Everyone knows getting the echo when you have a heart problem, and that's very useful for us in terms of identifying where the murmur's coming from, which valves are affected, and they can quantify how much blood is flowing back. They use a tool called a Doppler, which measures the direction of the blood flow in the heart. And they can actually see the blood flowing backwards and forwards through those leaky valves. And they can also measure the thickness of the heart chambers, the size of the heart chambers, and how much the heart is contracting. So they can get a measure of contractility and see is the contractility very decreased. So in a dilated cardiomyopathy, where that heart muscle is very thin, it may only be contracting 20 or 30% versus 40 to 60% in a normal heart. It's going to be pretty obvious. And they're going to also be able to see if there's any tumors on the heart, if there's any other problems, a fluid around the heart, a pericardial effusion, that can be a problem that could cause heart failure, but can be treated pretty easily just by draining that fluid or getting rid of that pericardial sac for them. So when we diagnose a dog with heart failure, there's going to be two types of dogs we see. The ones that are not that sick, that maybe have a little bit of cough, we can get them on some medications, or the ones that come in, they're in really bad shape.
Yeah.
They're having a tough time breathing. They're blue. We already have them on oxygen. We're going to get them started immediately with a diuretic called furosemide. Lasix is the brand name that most people will know this by. And diuretics basically work on the kidneys by getting rid of fluid out of the body. So they pee a lot, and then that decreases the blood volume. The less blood there is, the less hard the heart has to work. And it allows that fluid that's accumulating in the abdomen or around the lungs or in the lungs to be pulled back into the circulation and help reverse the problems with the heart failure. So we'll initially start them with an injectable dose to get them immediately under control, and then continue them on oral medication. In really severe cases, these animals have to be admitted to the hospital. They need to get in and be in an ICU. They need to be on oxygen, whether that's a nasal cannula or something, until we can get their heart failure under control with medication. If they end up being one of these Class D dogs that are refractory, they may not come out of that situation. If they're coming in and they just have the cough and they've been getting a little tired, we'll put them on some oral furosemide. Yeah. Another medication we use really often is enalapril or benazepril. Those are both what we call ACE inhibitors. They're vasodilators, and they help dilate the blood vessels, so it's, again, easier for the heart to pump the blood out. It has less resistance when you think about trying to suck up water through a really tiny straw versus a big hose. You'll be able to suck up a lot more, and it's just less resistance. So that's very useful, and we can use that drug, especially if dogs are these Class B we know they have structural heart disease, they have a heart murmur, and we want to maybe have a little heart enlargement. We may want to put them on that medication to slow down the development of their heart disease. And certainly the ones in the Class C, we're going to put them on there as well. And this is a lot of times a once-a-day medication, and it's very helpful. I use it a lot in the cats, especially with the hypertrophic cardiomyopathy. The next thing we want to do is try and get the heart muscle working better. The old drug we used to use a lot was digoxin, and digoxin is a very toxic dose, has a very narrow therapeutic range. You always have to do blood levels to make sure you're getting the right level. It caused vomiting and diarrhea in a lot of animals. It did help with the heart contractility. It helped with some of the arrhythmias, but it was really difficult to use. We usually had it in liquid because we would change the dose very little to try and get that into the proper level for the animals. That's been replaced in the last few years by a drug called pimobendin. And whereas digoxin is what's called an inotrope, it helps increase the contractility. This is an inodilator, so it not only increases the contractility, it helps vasodilate as well. So it can be used with the ACE inhibitors or even just by itself. So it's a more expensive medication than digoxin, although digoxin's gotten pretty expensive, especially on big dogs, because it's just not available as much. But pimobendin can make a huge difference, and it definitely will increase their lives and get them out of that heart failure symptoms pretty quickly. In cases where we have animals that have very fast heart rates because of their heart disease, and this can be the hypertrophic cardiomyopathy in cats, or even the dilated cardiomyopathy in the bigger dogs, that they have a very fast heart rate because of their atrial fibrillation, beta blockers are helpful. And beta blockers can have a negative inotropic effect, but what they're basically doing is they're slowing the heart rate. So now the heart has more time to fill, so each beat they're pumping more blood out, so it can actually increase cardiac output, even though it's slowing the heart rate. So you just have to kind of think, if you're pumping a pump really fast and you're just getting a little bit at each time, but if you just let the pump kind of fill up and then give it a big squeeze, you're going to get more air or fluid moving through that a lot more effectively. The other drug that's sometimes used, and a lot of times cardiologists will use this in animals that aren't responding well, is spironolactone. This is an aldosterone antagonist. Aldosterone is one of these drugs that helps you conserve sodium and fluid in your body. This basically reverses that and allows you to pee a lot. So it works like the diuretic. You have to really watch sodium levels when you're putting an animal on this because they can lose a lot of sodium and start to have problems because of that. So that can be a bad side effect, especially since we're going to put a lot of these animals on a lower sodium diet. Sodium does retain more water in your system, so if you have less sodium in you, the less water you'll have in your body, and the better you'll be with your heart failure. I think one of the hardest things to do is dealing with an animal with heart failure and kidney failure. Because when they're in kidney failure, we want to give them lots of fluids, but if you give them too much or they can't handle it, it starts building up in their body and their lungs, and you can actually have problems from that. So managing the two of those together can be a challenge. The long-term prognosis for heart failure is poor because we're not curing these animals. There are maybe some conditions where they had an infection in their heart or they just had some irritation to their heart that caused an abnormal rhythm. Those can be reversed. But for the most part, when we're dealing with valvular disease or dilated cardiomyopathy, this is going to go on and on. But most of them do respond to treatment, and most of them have a much better quality of life with the medications. I always tell people heart disease is kind of a very sudden onset, even though the disease can progress for a long period of time, because the heart compensates for that decreased function. When I was reading is you have to have almost 75% backflow of blood through a leaky valve before they start to show signs. So you can have an animal that's only half the blood is pumping with each beat, because if 50% of it comes back, and they still can do fine because their heart compensates for that. So it's like walking towards the cliff. When you get to the end of the cliff, you have no place else to go. You just fall off, and that's when all the symptoms crash on you. So it's not unusual to have these animals come in very quickly or have this cough develop very quickly, even though they've been suffering from the stage B, class B disease for quite some time. The other interesting is dogs don't get the clogged coronary arteries like people do that causes heart attacks. They just don't. They have a different cholesterol metabolism, so they don't get that cholesterol plaque buildup in their coronary arteries.
Even if they're eating a bunch of junk food?
Even if they're eating a bunch of junk food. They can get a lot of plaque in their the outside of the vessels, in the aorta and the other vessels, and that's usually oftentimes associated with low thyroid. So those are things that we're going to look for. So if you have a dog with a cough, especially one of these little breeds, and especially if your vet's told, hey, they've got a murmur, make sure you get them in and get them checked out. One of the things I'll have people do with dogs and cats that have heart murmurs is monitor what's called the resting respiratory rate. And that's where you count the number of breaths they have in a minute while they're sleeping, ideally, or when they're resting very comfortably. And just check that once a week or more often if you think you need to, and look for a sudden increase. And that's a very sensitive measure of whether they're developing heart failure or not. So if you do a resting rate and it's 15 for the longest time and it jumps up to 20, that's when you need to call your vet and say, you know what, he's starting to breathe faster. Maybe we need to start him on medication, or if they're already on medication, adjust their medication. We're also going to be watching their blood pressure too, because hypertension not necessarily is associated with the heart disease, but can be along with it. So if they get that, we want to deal with that as well. We don't want to have the deal with high blood pressure as well as the heart disease on top of it. So I think when we have the animals with murmurs, a lot of times we're just going to tell people to watch them. I think it's important, really important, you have good dental care too. Because when you have a bad mouth, that bacteria can get into the bloodstream. And when you have a valve that's already damaged and causing a leak, they're more prone to get endocarditis, which is an infection of their heart valves. And so if you don't keep their teeth clean, you can have problems. We anesthetize animals with heart murmurs here all the time. You do some extra steps to make sure that it's going to be safe. You're going to do the chest x-rays before you do the anesthesia. We're going to use anesthetics that are very quickly metabolized in the body. We're going to use very short-acting gas. We're going to give them an antibiotic dose before we start the procedure, so that as we're getting bacteria in the bloodstream, as we're cleaning teeth, we're not going to end up with an endocarditis. And then we're going to make sure that people really kind of work on that at-home care so we don't have to do that again. I always tell people we're looking at is the benefits of the procedure outweighing the risks. And in most dogs with a bad mouth, and a lot of these little dogs are also prone to very bad dental disease. And if we're not going to get those teeth taken care of, we're going to end up having to do it when their heart failure is maybe not as well controlled, and it's going to be a much riskier condition. So if your vet tells you, they're too old, or the heart murmur, they don't want to do the teeth cleaning, get a second opinion. You might find somebody who's willing to do it, because it is going to increase their quality of life and their length of their life. Ready to move on to pet health news here? Okay, I heard this. My friends were telling me about this story, and I go, this didn't really happen. And then I looked it up on Facebook, and sure enough, it did. Yeah. So why don't you tell us about Perdita?
Perdita. Yeah. So usually when you think of animal shelters, they usually do the highlights of the pet. Loves to cuddle, loves to, lay on your lap, loves to go for walks, things like that.
Right, yeah.
Perdita, at the North Carolina shelter, they were very honest with this cat. Her title was World's Worst Cat Up for Adoption. Many cats, when they're dropped off at shelters, they can get a little nuts because it's a big change and everything like that. The North Carolina shelter said she was Satan's evil spawn.
Oh my God. It's like trying to sell a car and say it makes all sorts of noises.
Yeah, it doesn't have brakes, but take the car. Yeah. But they were very honest, and I really appreciate that. One of their comments was, "We thought she was sick." So the Mitchell County Animal Rescue Clinic, they took her to the county just took her to a clinic. Yeah. And even a vet there said, turns out she's just a jerk.
She was perfectly healthy.
She was perfectly healthy, perfectly fine. The cat just has her very on personality. They said, that she was not for the faint of heart, according to the adoption ad and everything. They even made her like a bad dating app.
The ad, the ad is like
for the ad, yes.
Yeah, so this is the ad. If you were to read this, you would.
It was like a horrible dating ad for her.
This is what they put up on Facebook. Here. Go ahead.
They said, "Meet Perdita. She is not for the faint of hearts. Her likes staring into your soul until you feel as if you may never be cheerful again."
Oh my gosh.
Her favorite song is "Cat Scratch Fever," and if you don't know, that is a real thing.
Yes.
Her favorite movie, Pet Sematary, because Church is her hero. The evil cat is her hero. She loves to jump and scare people. That is her specialty. She loves lurking in dark corners, being the queen of her own domain, fooling the shelter staff into thinking she's sick. And that's how they got to the vet. Because, again, the vet just said she was a jerk. What she dislikes, the color pink. Kittens, because, who wants a happy, playful kitten?
They're so chipper.
They're so chipper. That's horrible, right?
Yeah.
Of course, dogs. Who likes a dog? Children, the Dixie Chicks. Disney movies, Christmas, and last but not least, her most hated thing, hugs. But she was single, ready to be, socially awkward with a socially awkward person who understands what personal space was. And to no surprise, her adoption fee was waived. So she was up for adoption for free. The shelter waived
So there's no way they're going to get anybody to respond to this, to adopt this cat.
Well, you know what? This ad had been shared nearly 9,000 times. And people were, almost 175 people came in and requested to see Perdita for adoption.
No.
Yes. A lot of applications were put through, and they actually had to cap it because so many were trying to adopt her.
Okay.
But she eventually was adopted January 28th of this year by a lovely couple named Joe and Betty.
Wow.
They, later renamed her Noelle, which is really cute name for what they call a little sympathetic cat.
Yeah.
But the shelter said that it was a successful meet and greet, which included minimum growling and very little slapping on her part and on her new parents' parts. So nobody slapped anybody, which was great.
Wow.
The shelter director, said that Perdita came in as a 4-year-old cat on Christmas. Yeah. And she came in like the Grinch and quickly asserted her dominance.
See, now she's going to hate the name Noelle because she's already crappy about Christmas.
Yes. But you know what? They also released a statement saying that we are all animal lovers and very patient. But they had been concerned about her for a while. And, they said you walk past, you look, she was sitting there with her. And she said, I'm looking at her right now. She's rolling around in her bed looking all sweet and cute. But the minute you go to try to rub her, she'll slap you. She would act like she was in pain. And again, they took her to the vet. And that vet, again, just said the cat's being a jerk. And, not many vets will tell people that. But But luckily, she did great. They did release a few comments from people who saw her ad.
Okay.
One of the people said Perdita was their spirit animal or their soulmate. There were some people who joked and wrote, this cat deserves to be in someone's life who they know, which was, but you know what? There, a lot of people were very happy for her. Somebody even wrote, I hope Perdita finds the goth home of her dreams. She got adopted and we're happy for her. She was only 4, so hopefully she comes down in her new house and has a nice, long, happy life.
I like this little thing here. The shelter had to warn visitors that she would be shy and kitten-like attempts to draw people in, and then it would end badly.
Yes, it was just a ruse. Yes.
Okay. All right. Well, the world's worst cat found a home, so I hope it's not with the world's worst pet owners, but it sounds like things are going to end well for her.
Yeah.
All right. The other thing in the news is there was this announcement. I used the DVM 360 news, and they're talking about one of the best new products of 2019. And it's not necessarily a product. It's a way of looking at blood panels from this lab called Antech, and they're all over the country. And so they came up with this thing called RenalTech.
Okay.
And what they're able to do is they took the blood tests from literally hundreds of thousands of cats, and they had how they progressed over time. They were able to then train an artificial intelligence system to recognize cats that were at high risk for developing kidney failure.
Oh.
And it could predict this 2 years in advance.
Wow.
So they do this free with all the panels. It's included in there. They have this patented technology. So if you get your panel run through Antech, you're going to get this. So they've just started doing this in October. They've already issued assessments on over 100,000 cats.
Okay.
And they think that this could basically help us react proactively instead of reactively. It could fundamentally change how we treat chronic kidney disease in cats. So hopefully this technology is going to be made available to a wider audience, and veterinarians, if you're worried about having if you want to have your cat's blood panel checked out, have your vet run it through the Antech test and see how it goes.
So that'd be cool. So just like with their annual blood work, you can just add it on to that.
Right, especially if you have a cat that you think is at risk, you have Antech run the panel, you get this value, and if they say, hey, the cat's not at great risk, beautiful. But if it is, there are things you can do with diet and things to watch for in the future so that you can.
Yeah, and it says it gives you up to 2 years before clinical diagnosis.
It's
so,
amazing.
Pretty much every 2 years you can just do this test on a senior cat.
Yeah, and it's this artificial intelligence. They just train this thing based on these blood panels. So I think that's really kind of
cool.
a neat thing. Yeah. All right, our case of the week. So this was a dog I saw earlier today, actually. And Cash was a new patient to the clinic here. And the owner had done one of those genetic tests that you can do on the mixed breed dogs.
Okay.
And they tell you what breeds your dog is. And this dog looked like a little border collie. And certainly one of the things was border collie, but it had Labrador Retriever, Golden, Great Pyrenees, and Boxer.
Okay.
No, not Boxer, Bulldog. Bulldog in it. But it also was positive for the MDR1 gene. And MDR stands for multiple drug resistance. It's kind of a misnomer because it's not so much that it's resistant to drug, it's more sensitive to certain drugs.
Okay.
So this is a nice thing to know, and especially for us vets to know, because two of the drugs it's very sensitive to is acepromazine and butorphanol, which is what we use for pre-anesthetics for medications. So if you give them a dose you'd give a regular dog, that'd be too much for this dog. So you need to really back that down. They're also very sensitive to a lot of the heartworm preventative medications, the ivermectin, the milbemycin, the moxidectin, at doses much higher than we would normally do in a preventative dose. So they can still take HeartGuard, they can still take ProHeart, they can still do Revolution, but they're just we oftentimes use those drugs at much higher doses for treating other parasites, mange and things like that. And then the third class of drugs they're very sensitive to are chemotherapy drugs. So if they're ever to get lymphoma or something like that, you have to be very careful because you can actually, doses that would make other dogs just a little bit sick, they can make these dogs really sick. So it's nice to see that, and they're going to be adding more of these tests, I think, onto these panels. So if you're thinking about getting this genetic test for your dog just to find out what breeds they are, you're going to get all this other information. And
Did they say which test it was? Which one?
I think it's the Mars Wisdom panel, but there's a couple of them out there. You can get them on Amazon. They just take a saliva test. There's like $60, $70.
Yeah.
Really inexpensive. And then bring those results into the vet so we can put them into medical records, and we'll have those available for us to use during the future workups and treatments for them.
Mm-hmm.
So sometimes we find out the hard way that an animal is super sensitive to a drug. This way we know which ones we can avoid right ahead of time.
Yep.
All right. Tech tips.
Yes.
So we talked about bringing in an old cat into the house, an old dog to the house.
Mm-hmm.
And I had a family the other day had adopted a kitten in with their dog. So I thought it'd be kind of neat if you could talk to some of the ways when people want to create a mixed household of cats and dogs. So
Yes.
they have a dog already in the house or a cat already in the house, and they want to bring in another species.
Mm-hmm.
And the thing goes, cats and dogs do not go together. But you always see these cute pictures online of these cats and dogs sleeping
Yes.
together and best buddies. So does that happen naturally, or is this something you really got to work at?
You know what? Just like people, it depends on the animal.
Okay.
A lot of times, and I will say mostly, I'm going to put you out there for that one, mostly cats. They can tend to be a little more stubborn when it comes to getting a new sibling in the house.
Yes.
Especially just because they're kind of territorial.
Yes.
Depending on, for dogs, certain breeds, they are open to everyone and everything. But again, dogs, just like cats, they can be territorial, and what's theirs is theirs. When bringing in, a cat into the household, firstly, you want to make sure, if you already have a dog, you want to make sure that that cat and that dog have their own personal areas.
Right.
Especially if you are bringing in this tiny 5-pound kitten and you've got a big old 100-pound lab or mastiff or something, you want to make sure that the kitten is in an area where the dog's not just going to plop down or lay on it or something like that. Or worst case scenario, you don't want to make sure your doggy knows that it's not a toy.
Yeah. Or food.
Or food, exactly.
I have some friends, they have a Doberman, and they got a couple kittens about 7 months ago, and they said, well, is this going to work out okay? I said, well, you'll find out if one of the kittens is missing.
Exactly.
At some point.
And a lot of animals do get rehomed for situations like
Yeah.
this. Unfortunately, we had a case just last week where they had to rehome their greyhound because it was trying to eat the son's cats. And, I feel sorry for the greyhound because I did love him. But it's not a treat. It's not a toy.
And it's amazing how some of them just take to them so readily.
They do, and a lot of time, older cats, they don't do great with puppies. But
Okay.
you do have a lot of older cats who will go up to a puppy and say, you know what, right now I'm bigger than you, and I'm going to assert my dominance. Which is why it's not always horrible to have a puppy with an older cat, because you want to let that cat know, this is my house, I'm going to tell the dog that you are my pet now.
Right.
And a lot of times as they get older, the dog will still have that mentality. And when the cat walks past, the dog will get up and leave because the dog knows the cat is higher up on that totem pole. And that is okay. A lot of times it is a little harder, the other way around, just because, you already have a big dog and the cat's not usually ever going to get bigger than the dog. But again, the biggest thing is always making sure everybody has their own personal space. When you have a puppy, you're doing training and things like that. So it's easier to do positive reinforcement for when the puppy is with the cat or something like that. You can do positive reinforcements with cats too. Put the puppy or the kitten and everybody together. If they get along and sit quietly, give everybody a treat. Make sure that, your dog isn't food aggressive when you're bringing in a cat around, because a lot of cats do love to eat dog food.
Right. The cats eat the dog food and the dogs eat the cat food.
Exactly. And you want to make sure that they're not food aggressive.
Yeah.
Because a dog, sure, they can walk away if a cat scratches them. Most cats aren't going to be that lucky if you get next to a 80-pound food aggressive lab.
Mm-hmm.
So you want to be, sensitive with that. My cat personally, he would literally chase away my Doberman and sit on top of his raised elevator dish and eat his food. And my Doberman would sit in the corner and be like, I'll eat once the king is done. And that's just how my cat trained my Doberman. And he knows he is the king of the house. So any other dog that comes in my house, even when I am pet sitting, he will walk up to the dog and just go meow and tell the dog to do something else. And I think I just get lucky for my cat personally. He knows he's the head of the hierarchy right under me, me in the house. Yeah. But these are just things, again, make sure that your pet is going to be okay for the situation. Before you go out and adopt a pet so you don't have to return it, see how you do if you can find another friend's cat or something to see how your dog would do with it. I always tell people, especially again for larger dogs, introduce them through a door for the cats. Because at least that way you can see how they are going to react. If they are pounding on that door, barking and growling, their hackles are up, maybe bringing in a smaller life to the household is not something that you want to do for a dog. And cats, they're, again, kind of finicky. They're probably going to do some hissing, some growling. But again, cats, they can get up to higher places until they're more comfortable coming down and seeing the new puppy or whatever.
Right.
But again, introduce through a door, have that space where they can feel comfortable. If you're bringing a cat into a dog's household, make sure you put a room aside for that cat to be in. Make it a bedroom or a bathroom or something until the cat is comfortable, especially if we're a nervous cat and we can have accidents here and there, because a lot of times kitties will do that when they're nervous. But they have a lot of things that you can do for calming things for cats. One thing is like feel away. I always recommend for owners who are bringing in a new cat, or when people start moving in, getting married or things, husband comes into the household with his dog and now kitty's not happy. I always recommend feel away.
Right.
Those pheromones do help the kitty out a lot.
They calm them down. They're a natural, relaxing, calming. And the dog doesn't smell them.
It helps a lot. Or we do recommend for some people, for dogs, doggy downers. It's not horrible.
And there's pheromones for the dogs too.
There
They've
are
got the
adaptable pheromones for dogs. And so there are a lot of options out there. But the biggest thing is always slow introductions. Always make it a positive thing. For two dogs, coming into the same household, there are going to be some, scuffles here and there. Same thing with two cats coming into the household. They have a hierarchy that they need to follow. And, you may come home, you may see a hairball here or there, or somebody's got a limp. And that's, as long as there's no pain or anything, that is something that needed to happen, because one does unfortunately need to be higher in a ranking than the other. And that's just how they work. But again, when you're together with them, make it a positive thing. For kitty cats, give them a Temptations treat that they like if they're sitting nice with the puppy or sitting nice with the other kitten. For dogs, give them a treat that's something that they never get. Give them like a little piece of lunch meat or a piece of cheese as a positive reinforcement, because all animals, do follow that. But I think cats and dogs living together, it is great. They are fun. They keep each other busy, especially once they do start to coexist really well. And then, you can start doing those fun videos of where the cat can knock down something for the dog and feed them for you, or the dog can help the cat get out the door or something like that, because they will start working together. And I know mine do it. My cat will open up my dog's kennel, and I'll come home and I'll see, because he'll just sit there and paw at the latch until it opens. And I'm like, I know I closed it because it's a double latch. And my dog can't do it, but my cat will for him. So it is fun. He wants
somebody to hang out with.
They do. They want someone to hang out with.
Well,
and they get along great.
Yeah, and I see this Doberman and these two kittens, and they'll be sleeping together on the couch, and but if that Doberman sees a squirrel outside, that squirrel doesn't have a chance if he can get to him.
Well, the Doberman knows the squirrel's at the lower part of the totem pole.
Well, and they know, so they do, and it works out really well. So send us those pictures of your cats and dogs together. That'd be kind of fun.
It's always fun.
Okay. Next week, we're going to move to the eyeball and talk about a fairly common condition, glaucoma. We see that in cats and dogs. It affects people a lot, too. So how we diagnose and treat that. So, and then I want to remind people, subscribe to our YouTube channel. Make sure you click on the little bell for notifications. The subscribe buttons should be underneath Brittney there. And if you're listening to us on a podcast, make sure you follow that podcast so you get notifications of that when new episodes are available. And then I guess I'm also going to tease, we're also going to have a Valentine's Day special coming out that our other receptionist and assistant, Monica, helped to do this time.
I had Chuckles do this one.
So that's it for this week. I'm Dr. Jim Hosek. Bye.